Do you want to empower your clients to make lasting health changes and achieve their nutrition goals? Discover how motivational interviewing can transform your counseling sessions. In this video, we'll explore what motivational interviewing is and how it can help you support your clients in making lasting nutrition and lifestyle changes. By the end of this video, you'll have practical techniques you can start using right away. What is motivational interviewing, or MI? MI is a client-centered, goal-oriented counseling approach designed to enhance an individual's intrinsic motivation and commitment to change. MI helps clients discover their own reasons for change, which are more powerful and lasting than external pressures. Why use MI? Originally developed for substance use counseling, MI is also effective for diet, exercise, and diabetes interventions. It can improve self-efficacy, increase physical activity, reduce caloric intake, and boost fruit and vegetable consumption. MI aligns well with the dietetic process and is useful in almost any counseling scenario, especially for clients who are ambivalent or resistant to change. The spirit of MI. The spirit of MI includes 4 key principles: partnership, acceptance, compassion, and evocation. Partnership. MI is a collaborative process. Both the counselor and the client are experts. Acceptance. Accepting the client's worth and autonomy with affirmations and empathy, and validating their feelings and affirming their ability to choose their own path. Compassion. MI counselors show genuine concern for the client's well-being, empathizing with their struggles and supporting their efforts. And evocation. MI involves drawing out of the client their own motivations for change. Now, let's put MI into practice with the steps, the 4 MI processes: engaging, focusing, evoking, and planning. Engaging involves establishing a collaborative relationship, creating a safe, non-judgmental space. This can be done by introducing yourself, your role, and what they can expect, as well as continuing to foster a positive, collaborative relationship throughout the session. Focusing involves narrowing down the areas of change, identifying specific goals to focus on. Evoking means drawing out the client's motivations for change and listening for change talk. That is when the client mentions thinking about, planning, or initiating change. And planning, developing strategies and action plans, setting realistic goals and identifying the steps for sustainable change. One of the most prominent and often used counseling skills in MI is a group of interaction techniques that goes by the acronym OARS, which stands for Open-Ended Questions, Affirmations, Reflective Listening, and Summaries. Open-ended questions generate discussion and sharing. They don't just elicit yes or no responses. They can help us to explore what is really important to the client. They usually begin with what, how, or tell me, and are intended to elicit change talk. We ask these questions with genuine curiosity and respect, rather than seeming like we are interrogating the client. We can ask about the pros and cons of the present behavior or the change. We can ask about the problem, and we can ask the client to imagine the future after making the change. Affirmations help us to build rapport with our clients, to create connection and build the client's confidence to change. We can affirm observations. Like sometimes a client will tell us that things haven't been going well, but when you get more details, we can see that they have made some positive efforts. To them, it doesn't feel like much, but we can affirm with our observations that they have made some efforts. We can affirm a client's problem-solving abilities. For example, we recommend plain Greek yogurt, but when they try it, they find it sour, so they add some fruit to it. We can affirm their problem-solving and how they worked it out on their own. And process. When we review their food journal, we can see that they haven't been eating very balanced meals, but we can affirm their effort in completing the food journal. Affirmations can also come from your client when you ask them things like to describe their strengths, past successes, and best efforts. Reflective listening is a fundamental part of MI. It involves utilizing active listening skills, working to understand the core message conveyed by the client, and then reflecting the interpretation back to the client. Reflective listening encourages clients to further share their thoughts. This demonstration of empathy fosters an environment conducive to self-exploration, regarding the difficulties of behavior change. It can be considered active listening, paying attention to the client, combined with hypothesis testing, checking if you've heard or understood the client correctly. You can reflect content as well as feelings. Here's an example. The client says, "I know I should be eating healthier, but I just don't have the time. Between work and taking care of the kids, it's hard to even think about cooking healthy meals." The counselor responds, "It sounds like you're feeling overwhelmed by your busy schedule and finding it difficult to make time for healthy eating." Summaries are connected to reflective listening, and during an MI counseling session can help to organize what has been covered already, clarify and reinforce concepts, provide links between concepts, and transition to a new topic. Sometimes discrepancies will arise, and that's okay. It's a good time to ensure you're on the same page. Here's an example. "I want to ensure I am understanding correctly. You're wanting to make some changes to your eating habits to ensure you live a long and healthful life, but you're worried about giving up your favorite foods and whether any changes you make will actually stick. Do I have that right?" Let's recap. MI is a client-centered, goal-oriented counseling approach. MI enhances intrinsic motivation and commitment to change. The spirit of MI includes partnership, acceptance, compassion, and evocation. The processes of MI include engaging, building a supportive client relationship, focusing in one specific area to work toward, evoking, drawing out the client's own motivations, and planning, setting specific goals to work on to make behavior changes. The OARS skills of motivational interviewing include open-ended questions, affirmations, reflective listening, and summaries. For a more in-depth overview of motivational interviewing with even more counseling skill examples, become a member of DSC to access our motivational interviewing mini course. And if you're ready to elevate your nutrition counseling skills with practical evidence-based techniques, join the waitlist now for DSC's Nutrition Counseling and Coaching Certificate Program, a program dedicated to helping you become more confident with your counseling skills through an easy-to-follow video course, practical workbook filled with scripts and examples you'll actually want to use, and monthly Q&A sessions with dietitians experienced in nutrition counseling. Join the waitlist now and get your free motivational interviewing cheat sheet.